You're ready for the last one. We have our own Tom Robbins, who's not only been the director of our NIOSH Education and Research Center, and Tom has now been appointed the new director of Global Health for the School of Public Health. So please welcome Tom Robbins.
Good afternoon. So, you know, the day they came out with PowerPoint, I said, thank God, I'm saved. I'm going to do my first talk without those crutches up there on the screen in more than a decade. So wish me luck. I'm going to need it. And even though all I'm going to talk about is my own life, my personal life, you know, I'll get a little bit about environmental health sciences in there, but just about what happened to me, I still need a cheat sheet. And don't be surprised if I refer to it. Okay, so I'll hold this in front of me. I'll feel much better. So here's what I want to tell you about. I want to tell you about how I ended up working on issues around capacity building and global health, which I find to be the most interesting, exciting, stimulating, rewarding work I've ever done. How I stumbled into it. How by complete chance I ended up doing this. And as I said, I have to thank someone for that. Probably not in the room. All right. So I sort of backed into medical school. You know, I got done with college. I did a few other things. I taught in a free school. I was an orderly for a while. And then I finally said, well, I guess I'll go to medical school. Because, you know, I was also always a nerd. You know, I always loved math and science. And I sort of was interested in being helpful to people. So eventually I went to medical school, and even though people thought I would become an internist because of the type of way I think about things, I decided I was going to do something, I was going to do family practice. And I left the Boston area. I'd had enough of that. I went to North Carolina, Charlotte, and I started this family practice residency. Now, I knew some people in Boston. I moved in with someone who was a legal services lawyer. So this means that he knew a lot of politically progressive individuals. So right away, I met these people who were spending all this time working for something called the Carolina Brown Lung Association. And I said, what was this? And they explained to me that raw cotton dust before it's processed, has been shown in all these different countries to cause chronic obstructive pulmonary disease. Something that looks identical physiologically, clinically, to what you see when people develop non-malignant lung disease from cigarette smoking. Irreversible, permanent. But in North Carolina, they claimed that they didn't have this problem. It was sort of like the American exception. So I got involved with this, and I started going to these clinics where we would see people for free who worked in the cotton mills. And I started reading up on it. I started writing editorials and various things. I became really persona non grata among the pulmonologists in North Carolina. And I got so turned on about this because I was doing something that if you had an impact on this, you had exposures that you could prevent for people in the future that could affect huge groups of people and could prevent illness instead of trying to treat it or cure it after it was already way too late. So this really turned me on. So I said, okay. I went to Michigan because somebody was here that I heard great things about to do an occupational medicine residency. That, by the way, was in 1982. I'm still here. So that went great. I love that. And one of the things that happened when I was up here in Michigan is I also got involved with the United Automobile Workers, the international union. They had a very sophisticated, still do, health and safety department. And I started looking at these issues about, you know, workplace exposures and how things get controlled in workplaces or don't. But of course, I was only looking at it from a domestic model. I mean, it was complex and challenging, don't get me wrong. And I did a lot of field epidemiology studies. You know, looked at some particular exposure in a workplace, like exposure to metalworking fluids, what they did every time they machined anything, and lung disease, that sort of thing, lots of other studies. And then I ran into some people in another department here, health behavior, health education, who were starting various studies in Detroit that were in community environmental studies. They said, the people we're working with in Detroit, they're very concerned about childhood asthma. We seem to have an epidemic of it in Detroit. And they're very concerned about exposures, ambient air pollution, also indoor air pollution, that might be triggers for aggravating childhood asthma. And I thought this was very, very interesting. It was different. It wasn't occupational, but you know, you needed, maybe I'll get away without this, we'll see. You needed the same kind of skill set to address these issues, I thought, as you did for occupational, so I was game for that. And the other thing that I loved about it was that they were doing community-based participatory research, which I'd never heard of before. So this was, you know, you have a steering committee and you've got partners from the representatives of the community, and you, the academics, are deciding jointly with the representatives of the community what should be studied, how it should be studied, what should be done about disseminating the results, and so on. So I really like this because I forgot to say this when I was talking about my eyes being open back in North Carolina. You know, first of all, besides this issue of like, hey, maybe you could prevent these things and things you discover could affect very large groups of people, not just individual patient by individual patient. The other thing is I really came to believe, to feel in my gut, that it's like a basic human right. You should be able to go to work without worrying about whether you're going to become sick. And you should be able to breathe the air where you live without worrying about whether you're going to become sick from doing that. So I was very turned on to this as well. So that's how I started doing both occupational and environmental studies. So you haven't heard me here say, I mean, this is all domestic, right? You haven't heard me say a thing about global yet. Well, how did I get to that? I thought deeply about it and decided that no, that didn't happen. What happened was that I got a letter in the mail from the International Institute for Education, which I'd never heard of, by the way, and I still to this day have no idea where they got my name from. Now, this is now 1989. And the letter said, we have this medical doctor in South Africa who lives in Durban, South Africa, who wants to come and study occupational and environmental medicine, health, and we're going to pay for everything, but we need a mentor for him. We need somewhere he can come to, and will you be his mentor? And, you know, I might have like said, I don't know about that, but they also included his CV. Very long CV, and it was real. So this is, I don't know, maybe some of you are too young. You know, there used to be this thing called the apartheid regime in South Africa. So it was still in power in 1989. And I read this and I realized he was a big operative for the African National Congress, ANC. The people are now in power in South Africa. The people are trying to undo this racist society. So I said, cool, yeah, come on down. I'd love to work with him. So actually the ANC kept him from coming for a year, but then he came, and the timing was good, well, at least for my future direction, because he shows up, and I know, like I have about a 1.5 year lead time on when I'm going to get my first sabbatical ever. You know, they really give you sabbaticals in the School of Public Health. That's an advantage of not being in the medical school. So he starts working on me. He starts saying, you know, Durban is very heavily industrialized. We have all these problems with exposures to workers. Durban has no zoning. We have all these heavy industries and other things going on, and right up against, of course, usually communities of color. We've got all kinds of problems, and we don't have the know-how. We don't have the trained personnel to address this. We don't have the knowledge base that you have. You need to come spend your entire sabbatical in Durban. So eventually, I came around. By the way, this guy later became the at the time, he was just like, you know, all right, he had his medical degree, but not too much else. He was quite a mover and shaker. His name was Barry Kismasamy, it still is. And he became the dean of the School of Medicine at it was then the University of Natal. Now it's the University of KwaZulu-Natal in Durban. So I went there, and I had an eye-opening experience, because I thought I knew how bad things could be from North Carolina for workers in the US. So what did people show me the first week I was there? They said, okay, we're going to go to the hospital, to this ward, and I'm going to show you these 2 different individuals that are in permanent vegetative states, in a coma. They're never going to wake up. They're not dead, but they're never going to wake up. Why? Well, funny, I should be talking about this after you listen to Dr. Basu's presentation. They worked at a facility outside of Durban, which was being supplied with in different types of industrial waste, actually from one US company and one company in the UK. And the whole point of this was it was to recover the mercury. because Mercury's expensive and worthwhile. And there was no precautions, no information, nothing about any of this could be hazardous, and this was the result. I thought, wow, that's something. So next, they said, well, they were in a clinic, they said, we want you to see some of these work. I saw like 3 different workers. And okay, so how many of you know there's something called nasal septal perforation, a hole between the 2 sides of your nose? And I bet almost everyone in this room knows the most common cause of that in the US. Cocaine abuse, right? Well, the most common cause in Durban was being exposed to chromates at work without any controls. And there's something called, you get this from, they also had ulcers in their skin. By the way, chromate, you know, is a human carcinogen. And we weren't doing a study at that point. So I said, wow, you know, there's a lot of things that need to happen here. Now, what was very interesting about the situation there, I'm so glad that everyone was so quick, because now I just go on forever, not worry about how much time I'm taking. Okay, here, I'll just tear the half of this apart. We won't do that half. Okay. So there I am, and you know, in the US, I mean, I'll be frank, I mean, I'm like amazed by my colleagues I have here. You've heard them, they do wonderful things, but my feeling about being an occupational medicine person in the US was, okay, great, I'm trying to do something, and there's like 1,000 other people just like me who could replace me the next day. And moving the way workplace health and safety is being addressed in this country, even moving an iota was like a, you know, incredible task, not easy to have happen. And here I was in South Africa, and this was right when, actually I was there for the election. So there's a completely new regime is coming in with a, you know, connected to the masses of people. And the question was, what were they going to do about occupational exposures? What were they going to do about environmental pollution? It was like a sort of open question. It wasn't all closed down and everyone been fighting about, you know, it was a new day. So that was very exciting. I said, oh, this could really make a difference. And then, in addition, I realized that, you know, they didn't really have trained occupational medicine people. They didn't have occupational health nurses. There were some occupational hygienists, industrial hygienists in the country, but they'd all been trained somewhere else and were usually with one of the few multinational corporations in the country. There were no programs south of the Sahara Desert to train people at the master's level or higher in occupational hygiene. They weren't dealing with ergonomics, etc. And they needed this for the people in academia that were going to train other people. And they needed this for the people that were working in the government, the people that had responsibilities for occupational environmental exposures, Ministry of Health, Ministry of Labor. These people weren't trained. They had inspectors that would go to workplaces, but did they know what they really should be looking for? Was not very clear. And they also, you know, the employers needed some information and some training. Maybe they would hire somebody, maybe, you know, that people didn't really know what was going on. So I said, this is what I want to do. This is what I want to work on. So I said, great, let's start doing all this. And what happened was we worked together very closely, and we eventually applied for funding because it came from the Fogarty International Center, which is in the U.S. National Institutes of Health. It had to have a big research patina. I mean, I like research, don't get me wrong, but it had to have a big research patina on it. Although we did say we were going to do things like work with trade unions too, and that seemed to be fine with the Fogarty International Center. So we were able to get funding to start trying to build capacity in occupational environmental health, have people trained at a higher level. You know, there were some people in Cape Town, I didn't say this, there were some people in Cape Town and Joburg that were doing some of this already, but still a very limited number of people, and nobody in Durban had really been doing it before. So we were able to start this program. And what we did at first was we brought people to Michigan, sometimes for a short-term study, but often to complete a master's degree or to complete a PhD, which was fine, except as we went on, because we kept getting recompeting, getting funded for another 5 years, so as we went on, we began to realize, you know, things are not that bad in South Africa compared to the rest of this, what's called the Southern African Development Community, economic unit, 14 countries, all the way north to Tanzania. And we need to come up with the most, because we didn't have that much money from Fogarty, that's a big region. We should be coming up with the most cost-effective solutions to try to accelerate capacity building and occupational environmental health through the whole region. We needed a regional approach, not just for South Africa, which was in relatively good shape. And I was working with these wonderful South Africans that, you know, they were complete, what do you would call them, internationalists. This is what they were totally oriented to doing this. So we realized one thing we were going to do is, which I hate to say this in front of my chair, but we were going to stop bringing many people to do degree programs at Michigan because it was like 10 times less expensive for them to complete those same degree programs at South African universities. And we were going to do that instead. And we had all, you know, he hears no evil. So that happened. And the other thing is we picked Tanzania, Zambia, Zimbabwe, and Mozambique because they had the most potential. Of the other countries in SADC, this 14-country, they had the most development, the most potential to really accelerate their capacity quickly. And we set up what was called a National Review Committee. Now, the other thing, I don't know why I did this. I guess maybe it was all those years of CBPR and the UAW and also by very progressive colleagues I was working with in South Africa. But when we set this whole thing up, we set up what we called a Program Review Committee, which was a steering committee, okay? And it set the whole direction of these training programs, what was going to happen. Well, and maybe it was because I was like selfish with my colleagues here, that'd be the last reason, but I was the only person on that committee that wasn't from one of those countries I just named in Southern Africa. So this was a situation where the people on the ground who understood the problems, understood the needs, and were best positioned to say what needed to happen, were calling the shots, really making the decisions, which is part of why I think we were able to be quite successful in many different ways. So I'll just give you an idea. I've told you about a couple of occupational situations. So one of the things we did is we did a study at a school called the Settlers School, a primary school, elementary school. This was in an area called South Durban, where on one side of the school, and I'm talking about half a kilometer, the perimeter of this facility was half a kilometer from the school. On one side of the school was one petroleum refinery called Engine. And on the other side of the school was another petroleum refinery called Saprif. And between the two of them, they did 80% of the petroleum refining for the entire country of South Africa, which is a very industrialized country. And here was this school in between. And there had been incidents of hundreds of children becoming ill and going home on certain days. And by the way, I don't want to go into too much detail because, you know, at some point someone will grab a hook or at least a gong. But, how big's that hook? Oh, okay.
Go ahead. A minute.
But so they were using, you know, when you are processing petroleum, you need a big source of energy. You have to crack it, right? You got to heat things up. So they were using oil that had fuel oil that had very high sulfur content. So unlike the situation in the U.S., besides producing particulate and oxides of nitrogen, et cetera, they're also producing huge levels of sulfur dioxide, which is another extra little whammy there. And they weren't scrubbing it, and they didn't have the big, tall stacks that some of the places have in the U.S. in response to EPA regulations, so things would come down locally. And we did this study, and the thing that was interesting is because it all came back to CBPR, in fact, because there'd been years of community pressure about trying to get this situation addressed. Okay? And because of that, the municipality of Durban had set up a station on the grounds of the school where they were doing monitoring for PM10 and sulfur dioxide and nitrogen dioxide, et cetera. And actually the industries, which there was also a paper pulp mill that was making SO2, these three industries were actually paying to have this done, you know, sort of a quote-unquote goodwill gesture. So we just came in and said, oh, we're going to evaluate the health of the children. And so we had these elementary, I mean, you know, we got informed consent and everything else, but the way the teachers were really thrilled we were there. So we ended up, so imagine, they all wear uniforms, even though they're in public school, you know, so imagine all these kids in uniforms, and we were there, and we had devices we'd used in a study that, measure pulmonary function that you blow into. And so we trained all these kids how to do it. And then 4 times a day, we'd have them stop. And they'd blow into their devices and also write down, check off whether they're having any symptoms. So that's how we got the data. And we also did sophisticated things, like there's something called a methylcholine challenge test, which looks for physiologic hyperreactivity of the airways, something that goes with asthma. They had the highest levels of people with marked hyperreactivity we'd ever seen anywhere in the literature. Of course, that doesn't prove what's caused by all this pollution. And we also showed that with a lag of 1 or 2 days, they all got sicker when pollution levels of these various things went up. And then following that, I am going to come around and wrap this up. So following that, because of those results, we got funded to do a much bigger study that actually compared South Durban to several areas in a different part of Durban that were similar in terms of race, ethnicity, and socioeconomic position, but didn't have the same exposures. A much more sophisticated study to sort of compare what was going on. And I'm proud to say, and this is an example of capacity development, the person who was the PI of that study is named Rajan Naidu, who was one of the first people we had brought to the US. He was already a medical doctor, but he was like a house officer. He was one of the first people we brought to the US to complete a PhD, which actually he did on coal workers who had never been studied in South Africa before. And he was the PI on this very large study, and he's now an associate professor, and he's now also the head of a department that didn't exist at University of KwaZulu-Natal before, and this department is called Department of Occupational and Environmental Health. And there's a lot of very nice success stories like that that I don't have time to go into.
Nope.
So, in summary, I'm going to stop there. But so what I like about this, what I like about doing this kind of work, is that you feel like you can really have an impact, and that because there's a political opening, and you can actually, we did this, you get ministries involved, and when you come out with study results, the results get used to form policy that gets implemented. Things actually happen, things change. This is a strange concept for those of us that grew up in the US, but things can actually change. So that's like very, very exciting. And it combines like all the things I like. You get to be nerdy, and talk about math and science, and you get to like interact with people, and you get to feel like you're making big changes that are protecting people's basic human rights, and you get to talk to a lot of people, and you get to go to places where, cultures you've never been involved with before, that, exotic places that are very interesting to go to. So I feel very, very lucky, and I'd like to thank whoever it was at the International Institute for Education who sent me that letter. Thank you.
Thanks, Tom. I hope you're as delighted as I was to see a new facet of our faculty, sort of the more popularized, the more let's get out and really have fun aspect of presenting science. And that's essentially why we love being in academia. There's some aspects of it that are a lot of fun, but most of all, it's been interacting with the students and seeing them grow and prosper, become alumni, and especially rewarding to see them come back today. More than anything else, passion is what drives our faculty. This new cross-disciplinary paradigm that we've been producing so successfully has been an absolute pleasure to watch. And as we embark in the next phase of development and growth of the department, this part, that is cultivating a wider community and investing in our alumni's return and making those bonds much stronger, is an absolutely essential part of it. Now I'd like to give a thank you for your close to all of our TED speakers. They were just absolutely fabulous.